What are the best parts of the medical industry that we should be utilizing? What tests should we make sure that we should do? What procedures? So what are the parts that you do like and would want to make sure that we utilize?
When I was in training, my resident in emergency medicine says you can divide all of medicine into two types. There's horizontal medicine and vertical medicine. If you are so sick or injured that you are horizontal on the gurney, boy, Western medicine is what you need. And boy, they are wizards at pulling you out of death's door right there. And thank heavens for all the emergency trauma surgery and all the antibiotics for septic shock. And modern medicine is just stunning in its power to deal with people who are in extreme medical dilemmas. But that's 10% of medicine. 90% of medicine is vertical medicine. If you are vertical and walking around and you have these chronic diseases that most of Western medicine says, etiology unknown. We don't know what causes high blood pressure. We don't know what causes type 2 diabetes. We don't know what causes clogged arteries. If you're dealing with doctors who are trapped in that way of looking, there's not going to be much they're going to offer you. Most people know when they're sick, and you go get treatments for specific diseases. But I think that most of the screening that is done should be needs to be discarded for the reasons we talked about. So I'm all in favor, as an old anesthetist, magic can happen in the operating room, but a lot of disasters and troubles can be brewed there as well. So I'm for most everything that has to do with acute care medicine, but as far as chronic disease care, unless they're talking about I ask every patient, take me through your eating day. From breakfast, lunch, what you really put in your mouth. Until physicians start asking that question to every one of their patients, they're going to be treating symptoms or making things worse. So in answer to your question, has to do with the acute care medicine, but the chronic care has a long way to go until they recognize the importance of their patient's diet.
Yeah, and I tell my patients, in fact, this is one of my talks, is that the diagnostic and therapeutic tool of the 21st century is the meal plate. And that's the #1 screening and treating tool that we have, or should have. And if you remove all the causes of diabetes and arthritis and high blood pressure, et cetera, from your meal plate, then that's the first line of therapy. Because I can do all the tests in my office. We do nuclear stress, PET scans, we do a whole gamut of things. And all the tests can come up normal. And you can still have some pre-level biochemical abnormalities, some disease state that we miss. We can actually do an angiogram. I have images showing an angiogram that looks quote-unquote normal. But then if you put an ultrasound wire across those arteries, you see plaque inside the arteries. And so we've had patients go in and get an angiogram, so your arteries are normal, the cardiologist will tell them, and then a month later they have a heart attack. I've cathed the patient who came to the emergency room in the throes of a heart attack, and I did an angiogram. And by the time I got him to the cath lab and took a look at his arteries, the thrombus that had occurred, that formed and caused the heart attack, had dissolved, and the remaining part of the arteries looked normal, quote unquote. And so all of our tests, while they can be helpful in certain settings, disease states start at the cellular level, the subcellular level, and we really don't have any tests that can pick up these diseases at these early stages. It's only if you know that you're putting bad food in your mouth that you have some level of disease. The disease state is not an abnormal blood test. It's not an abnormal imaging study. It's not an abnormal angiogram. The disease state is abnormal stuff going in your mouth. And so if you have one bite of chicken or one bite of fish, then you have a disease. It doesn't matter what my tests show. And it's only a matter of reversing that disease. It's reversing the process of putting bad food in your mouth. That's in essence what we have to do.
I think one of the problems with population screening, with very few exceptions, is, and it goes to your point, that that's really, we're measuring the wrong things. We're, instead of backing it up and measuring what the lifestyle factors are, but it encourages this mentality that I'm going to eat, drink, and be merry, and then I'll visit a doctor or 2 or 5, depending on what's going on with me, I'll have tests done. They inevitably come back, you're okay. Remember Tim Russert, I said this afternoon, 6 weeks before his fatal heart attack, he was okay, whatever that means. But you get the okay, and then people say, well, I guess I can just go back to sitting on the couch and eating cheeseburgers and french fries, and I can get tested next year, and I'll see if I'm still getting away with it. They don't really verbalize that to themselves, but that's essentially the philosophy that people are practicing. I'm going to do it until I can't get away with it anymore. Okay, now apply that to anything else. I'm going to drive my car, I'm going to run stop signs until something bad happens. I mean, what kind of a strategy is that for driving a car? But that's exactly the way people conduct their health lives, by the way that they eat. So diagnostic testing should be used very, screening and population screening I think is a very bad idea, and these screening tools have some value, but if we use them more judiciously, we would get rid of that thinking that you show up, you get cleared, and then you just go on and live your life waiting until the next time.
Little boy was caught masturbating by his parents, and his father says, "You keep doing that, you're going to go blind." And the boy says, "Well, can I do it just till I need glasses?"